If you have poor circulation after 60, don't take supplements. Do this instead. Listen to me for a moment. If your feet are always cold, your ankles swell at the end of the day, you wake with cramps in your calves, or you've noticed numbness or a sore that won't heal, reflexively buying a circulation pill is not the right first step. Those bottles are marketed to hope, not to diagnose. What you need first is a practical, doctor-backed approach that restores real blood flow, protects tissue, and points you to the tests or treatments that can actually change outcomes. If you want practical, clinician-backed tips for aging well and protecting your circulation, subscribe. I'll walk you through a 10 to 15-minute daily routine you can start this week. I'm a physician who spent years seeing older patients who tried supplements first and ended up months behind on the real problem. I'm not here to demonize every product on the shelf, but to be honest, supplements rarely fix reduced blood flow. They can create a false sense of security while arterial disease, venous problems, diabetes, or deconditioning quietly worsen. Worse, some supplements interact with medications or cause side effects, and the quality varies a lot from brand to brand. So what is poor circulation, really? There are 3 common patterns I see. First, peripheral arterial disease, PAD, is narrowing of the arteries that bring oxygenated blood to your legs. Think of it like a garden hose that has developed scales inside. Less water gets through, and the far end dries out. PAD often shows up as pain with walking, claudication, coldness, peeler skin, hair loss on the legs, or slow-healing ulcers. Second, venous insufficiency involves problems with the veins that return blood to your heart. When valves fail or flow is sluggish, blood pools in the lower legs. That shows as swelling, heavy aching, darker skin near the ankles, or varicose veins. Third, neuropathy, commonly from long-standing diabetes or other nerve injuries, can make your feet feel numb or tingly, and reduced nerve function also impairs circulation indirectly because you're less likely to use those muscles properly. All 3 are often linked to the same systemic risks: high blood pressure, high cholesterol, diabetes, smoking, and inactivity. And here's a clinical point many people don't know. Erectile dysfunction in men can be an early warning sign of vascular disease. It's not about shame. It's a clue that the same small vessels supplying the penis may be affected by the same process limiting blood flow to your legs. Now, why not supplements as the first move? There are several reasons. Supplements are not standardized the way prescription drugs are. Labels can be inaccurate, potency varies, ingredients may interact with medications like blood thinners, statins, or blood pressure drugs.
Most importantly, taking a supplement can let you check a box, I tried something, while a serious, treatable vascular condition goes undiagnosed. If an artery is narrowed or blocked, you may need investigations like an ankle brachial index or a vascular ultrasound, and possibly medications or procedures. A pill bought online won't tell you that. Instead, here is a simple, practical alternative I want you to adopt today: the circulation reboot. It's a 10 to 15-minute protocol you can do twice a day. It's low cost, evidence-aligned, and safe for most people, with a few sensible precautions I'll mention. This routine focuses on restoring flow through consistent movement, strengthening the calf muscle pump, improving venous return, and protecting the skin at the end of your limbs. Before we start, if you have unstable heart disease, recent heart attack, uncontrolled high blood pressure, or you're unsure about exercise limits, check with your clinician before you begin. And if you ever have chest pain, severe shortness of breath, fainting, or sudden severe leg pain, stop and seek emergency care. The circulation reboot, morning and evening, about 10 to 15 minutes total. 1. Warm-up and ankle mobility, 2 to 3 minutes. Begin seated or standing with support. Move your ankles through full range. Point your toes down and pull them toward your shin. Make slow ankle circles in both directions. Lift your toes while keeping heels down, then lift heels while keeping toes on the floor. Do 10 to 15 repetitions of each. The ankle is a small joint with a big job. Mobilizing it primes blood flow into the foot and ankle. A common vignette: Mr. Hector, 67, told me his toes were numb and cold every morning. He thought a supplement would warm them up. When I showed him ankle mobility and ankle pumps, he saw more warmth in minutes and felt more confident walking later that day. He didn't need a miracle pill, he needed a habit. 2. Short walking intervals, 5 to 10 minutes, twice a day if possible. Walking is the single most effective, low-risk way to improve peripheral circulation. Aim for 2 short sessions per day, about 5 to 10 minutes each, brisk enough to raise your breathing slightly but not to exhaustion. If you can build to 10 minutes twice daily, do it. If walking outdoors isn't safe or practical, march in place or do seated marching. Lift knees and pump arms to increase circulation. If you experience calf pain with walking that forces you to stop, that's a classic sign of claudication. In that case, the approach is still walking, but in intervals. Walk until you feel discomfort, rest briefly, then walk again. This pattern, done consistently under clinical guidance, can improve distance and circulation over weeks. Mr. Roberto, 72, began walking 5 minutes after breakfast and again after dinner. He kept a little notebook and tracked distance. In 3 months, he could walk twice as far before noticing calf discomfort. He did this without buying a supplement. He used steady, progressive movement. 3. Leg strength microsets, 2 to 3 minutes. Leg muscles act as a pump to push blood back up toward the heart. Simple, short sets done multiple times a day build that pump. Try sit-to-stand exercises. From a stable chair, stand up slowly and sit back down 8 to 12 times. If that's too hard, start with assisted stands using your hands on the chair. Add calf raises. Holding support, lift up onto your toes, then lower slowly, 10 to 15 repetitions. Do 1 or 2 brief sets of these during your reboot or whenever you rise from a chair. 4. Ankle pumps and leg elevation, 2 to 3 minutes. Lie down or recline with your legs supported. Pump your ankles back and forth. Quick, rhythmic movements of pointing and flexing for 1 minute. Then, if tolerated, elevate your feet slightly above the level of your heart for 1 to 2 minutes. For venous congestion, elevation helps venous return. For arterial disease, avoid prolonged elevation that causes numbness. Use elevation as a comfort-based step. Compression stockings may be helpful for venous problems, but should be recommended by your clinician, especially if you have peripheral arterial disease. In PAD, high compression can be risky if you don't have proper vascular assessment. 5. Skin and foot check, 1 to 2 minutes. Inspect your feet daily. Look for changes in color, persistent dryness, cracks, thickened nails, or areas of pressure that could become ulcers. Run a quick touch check. Is there temperature difference between the feet and the rest of your leg? Moisturize dry skin to prevent cracks, but keep lotion away from between the toes to avoid fungal issues. Trim nails straight across or have a podiatrist help if nails are thick or ingrown. If you have numbness from neuropathy, you may not notice a small wound. That's why visual inspection matters. 6. Daily habit cues, sprinkle throughout the day. Make small, consistent choices that add up. Walk after meals. A 10-minute stroll after eating is excellent for circulation and for blood sugar control. Avoid sitting for longer than 30 to 45 minutes. If you sit for TV or reading, get up and do a set of ankle pumps or march in place. Keep your legs warm when cold. Cooler temperatures constrict blood vessels. On long flights or drives, wear clinician-recommended compression socks and move every hour. If you smoke, seek support to quit. Smoking is one of the most damaging things for your circulation. For people with limited mobility, the protocol adapts. Seated marching, ankle circles, resisted toe taps, and leg lifts while seated can all help. Use elastic resistance bands for ankle strengthening if you have them, but avoid high-intensity loading until cleared by a clinician if you have heart disease.
Safety notes woven into the practice. If you feel chest pain, sudden shortness of breath, lightheadedness, or fainting, stop and seek emergency care. If you notice sudden severe leg pain at rest, sudden swelling of the leg, a rapidly spreading area of redness, or fever with a wound, seek urgent evaluation. These can be signs of clot, infection, or critical limb ischemia. When should you see a clinician for tests? Ask for an ankle brachial index, ABI, if you have symptoms like calf pain on walking, non-healing wounds, or significant coldness. ABI is a simple office test that compares blood pressure at the ankle and arm to estimate arterial flow. If ABI suggests reduced flow, a vascular ultrasound, duplex, can map the arteries. Blood tests are important too. A1C for blood sugar control, a lipid panel for cholesterol, and basic metabolic markers. If you have erectile dysfunction alongside leg symptoms, mention it. It's a helpful clue that vascular disease may be systemic and needs assessment. Some patient stories to make this real. I once saw a man in his late 60s who'd felt numbness and bought multiple circulation supplements online for months. His symptoms progressed and a sore developed on his foot. When he finally came in, an ABI revealed significant arterial narrowing. He needed a vascular intervention and a coordinated plan for risk factor control. The supplements hadn't caused the problem, but they delayed diagnosis. Another patient, a woman in her 70s, had swelling and a feeling of heaviness in her legs. She had been told to take herbal products. Instead, she did structured calf exercises, wore prescribed compression stockings, and improved over several weeks with reduced swelling and better function. Where do supplements fit at all? They're not the first-line fix for impaired flow. In certain situations, if blood tests show specific nutrient deficiencies, say a proven deficiency in vitamin B12 or low vitamin D confirmed by labs, supplements may be discussed as part of overall care. Some agents are sometimes studied in research settings for microcirculation, but their benefit in established arterial narrowing is limited. The point is this: use supplements as an adjunct when indicated by testing and under your clinician's guidance, not as a replacement for assessment and structured rehabilitation. Lifestyle measures beyond the 10 to 15-minute routine are central. Smoking cessation reduces progression of arterial disease and improves outcomes. Tight glycemic control in people with diabetes reduces neuropathy progression and improves wound healing. Blood pressure and cholesterol management have powerful effects. Statins and antihypertensives are proven to reduce cardiovascular events. Decisions about these belong to your clinician and should be individualized. Sleep quality, hydration, and maintaining a healthy weight all support circulation.
Even small changes, a 15-minute daily walk, stopping smoking, stabilizing blood sugar, translate into measurable vascular benefits over months to years. Expectations matter. You may notice increased warmth, less tingling, and improved energy within days to weeks of consistent movement. Improvements in walking distance and reduced swelling often appear within weeks to a few months. Structural changes, better arterial remodeling, improved wound healing can take longer and depend on the severity of disease and how well risk factors are controlled. If there are ulcers or gangrene, timelines vary, and you may need specialist vascular or wound care. Be realistic and celebrate the small wins. Addressing common myths. You will not reverse advanced arterial blockages overnight with a pill, a powder, or a single detox. Motion is medicine. Moving your legs regularly stimulates flow, helps the vascular endothelium function, increases nitric oxide, and builds muscle that assists venous return. Supplements marketed to boost circulation often rely on marketing language like support or promote, without proving they change meaningful outcomes like wound healing, walking distance, or need for vascular intervention. Medication review is part of the plan. Bring a list of all medications and supplements to your clinician. Some over-the-counter agents can alter bleeding risk when combined with prescription blood thinners. Don't stop or start prescription drugs without medical advice. At the same time, don't delay asking your doctor about preventative medications if you have PAD. Certain drugs reduce heart attack and stroke risk and are appropriate for many patients. When to seek urgent care. Sudden severe leg pain, sudden swelling that is asymmetric between legs, rapidly progressing discoloration, fever with a wound, or chest pain are all red flags. If a limb is pale, cold, numb, or has no pulse at all compared to the other side, that is an emergency. Let me give you a practical 7-day starter plan to begin the habit. Day 1. Do the circulation reboot once in the morning and once in the evening. Keep sessions short and focus on form. Day 2-3, add a second brief walking interval after meals. Day 4-7, add 1 microset of sit-to-stand and calf raises to the evening session. Keep a simple log, time of activity, and 1-word note on how your legs felt. This habit tracking reinforces consistency. If you can maintain this routine 3 times a week, it becomes part of daily life in a few weeks. If you travel or have a long car ride, plan ahead. Stand and walk every hour. Do ankle pumps while seated. Wear compression stockings if advised. For cold weather, insulated footwear and warm socks reduce vasoconstriction and discomfort. For hot weather, keep hydrated and avoid prolonged standing. One realistic caution about compression. For purely venous disease, compression stockings and elevation are often very helpful. But if you have significant arterial disease, tight compression without prior vascular evaluation can be harmful. That's why an ABI or vascular assessment should guide compression decisions. Let's talk briefly about tests you can respectfully ask your clinician for. The ankle brachial index is quick, non-invasive, and instructive. Ask for it if you have walking pain, non-healing wounds, or persistent coldness. If ABI is abnormal, a duplex vascular ultrasound maps blood flow and identifies locations of narrowing. Blood work, A1C to screen for diabetes, fasting lipid panel, kidney function tests, and a basic metabolic panel are reasonable starting points. If your clinician suspects clotting problems, additional hematology testing may be needed. These tests are the tools that identify whether the problem is primarily arterial, venous, neuropathic, or metabolic. Throughout this process, communication matters. Tell your clinician about sexual changes. Erectile difficulty is a vascular clue, not an embarrassment. Tell them about sleep apnea if you snore heavily and wake gasping. Sleep apnea is linked to vascular risk and should be evaluated. Bring your medication and supplement list to appointments so your provider can check for interactions. You might be wondering, how long before I can stop worrying? There is no single finish line, but there is progress. Within days, weeks, expect more warmth and less numbness with consistent movement. Within 1 to 3 months, expect better walking tolerance and reduced swelling with persistence.
For wound healing or arterial remodeling, months may be required and specialist care may be necessary. The key is the combination: daily movement, risk factor control, protective foot care, and timely medical evaluation. Finally, a few practical tips many patients find helpful. Set a phone alarm that says ankle pumps twice daily. Leave a pair of comfortable walking shoes by the door so you don't use "I can't find my shoes" as an excuse. Pair walking with something enjoyable, a podcast, a neighbor, or your favorite music to make the routine stick. Keep a water bottle visible to remind you to hydrate. If balance is an issue, hold on to a wall or countertop for ankle exercises rather than risking a fall. I want to emphasize again, don't let marketing or a label replace a conversation with your clinician. Supplements may have a role when deficiencies are identified or as adjuncts under supervision, but they are not a first-line solution for the mechanical problems of blood flow, venous congestion, or neuropathy. The circulation reboot, 10 to 15 minutes twice a day, plus consistent lifestyle steps and timely medical testing, is a practical, proven path to better outcomes. If you have these symptoms, talk to your doctor and ask for an ankle brachial index.
Tell us in the comments which symptom brought you here: cold feet, swelling, cramps, numbness, or something else, and I'll respond with suggestions you can discuss at your visit. You don't have to accept poor circulation as an inevitable part of aging. Small, consistent steps matter. Start today with ankle mobility and one short walk. You'll be surprised how quickly those minutes add up to real change.